Hello, my name is Richard Furman. I am the director of the CLL Research Center at Weill Cornell Medicine in New York, New York. Today I spoke about how we should be managing our CLL patients in the present time. And I think it's really most important when we discuss how to manage CLL patients that we really keep a close eye on overall survival and really remember that, MRD is not the surrogate for PFS, or even if it is a surrogate for PFS, is not a surrogate for overall survival. The real important question that's going to confront us as physicians and our patients secondarily is the idea that when patients have progression of their disease, when they're ostensibly the cells are just proliferating, are they having secondary changes that might make them more resistant, difficult to treat later, or even transform into a Richter transformation, which is really how we lose our patients most often. And it's a question about in those patients who are at risk of developing those complications, namely those that are 17p deleted, TP53 mutated, have a complex karyotype or a Notch1 mutation or subset 8V gene usage, letting them proliferate can be very problematic. And in those patients, having them on a continuous BTK inhibitor theoretically provides a continuous suppression of proliferation and can prevent those secondary changes from occurring. In the patients without those abnormalities, what I call the genomically stable patients, you really do have options in terms of fixed duration versus continuous therapy. And I think what really becomes important is what the patient's preferences are. And many patients actually enjoy the idea of continuous remission being continually consolidated or prolonged with a continuous medication, whereas some prefer to be off medication. Of course, the fixed duration therapies, if you're going to use obinutuzumab, do require an IV, and if you're going to be using venetoclax, do require a lot of lab monitoring for tumor lysis prophylaxis. So those are all very important considerations to keep in mind, and it really does have a huge impact upon how the patients approach their day-to-day lives while they're getting therapy. But we do have a tremendous number of different therapies, and of course it's always great to have these different options. Thank you.